Today, let's talk about the counseling skill of questioning, where I'll break down the difference between open and closed ended questions and when we should use them. And I'll also talk about common errors in counselors' questioning of clients. In counseling, we generally want most of our questions to be open ended questions. However, there is a time and a place for closed ended questions, which we'll get into here shortly. So, open ended questions invite the clients to explore, reflect, and to elaborate on their thoughts, emotions, and experiences. They encourage deeper discussion and help clients gain self awareness. Open ended questions typically start with what, how, or tell me more. So, generally, when we're trying to get the client to explore more about their thoughts, emotions, or experiences, we want to ask those what, how, and tell me more questions to get that conversation really going. Open ended questions really do a couple of things for us as counselors. It helps promote client awareness and storytelling. We want to gather more information and storytelling from the client. The more data that we can get directly from the client, the more helpful it will be to us in understanding and conceptualizing their case. We also want to encourage insight and reflection. In counseling, it's not us just giving the solutions or answers to the client. It is them exploring their own thoughts, experiences, and emotions, and really gaining that insight that will best serve them, best help them outside of the counseling session. Open ended questions also help the counselor gather rich and detailed information. Especially when I go back to that storytelling, we want to hear these stories, this, and gather this data and get it in the client's words, in the client's perspective. Open ended questions also foster a sense of autonomy and control for the client. If we're asking a lot of close ended questions, we're really dictating where that conversation goes. But when we ask open ended questions, we're allowing that client to have autonomy and to take really that question in whatever direction they feel like is best for them. So, as I mentioned earlier, there is a time and a place for close ended questions. So, close ended questions are usually questions that can be answered with a quick yes or no or a really brief phrase. And they're really helpful when the counselor needs specific information or they need to clarify details of something. So, we typically see a lot of close ended questions in an intake session where we're just learning more information about a client and gathering details like demographic details or historical information. So, there are a couple of goals and benefits to asking close ended questions. One of those is to gather facts or to gather concrete data, as I just mentioned. Another is to help focus a client that may be getting off track or might be a little bit tangential. We can ask a really direct, close ended question to kind of refocus the session. And another way that we might use a close ended question is to check for understanding or to confirm information about something. So, once again, there is a time and a place for asking close ended questions. We just want to make sure that the majority of our questions are open ended and that when we do ask close ended questions, it's at an appropriate time and place in the session to do so. Typical close ended questions start with have, are, did, do. Really, any question that can be answered with one word, a yes or a no, or just a simple phrase, would be considered a close ended question. There are also two questions that I really want you to consider avoiding when working with clients. That first one is, how does that make you feel? We typically want to avoid this question because it's such a cliche therapy question, and it can really come off as ingenuine. So we want to maybe think of a different way to ask that. So an example of that might be, how did you feel when your father talked to you that way? So just be a little bit more specific and try to avoid asking that really cliche question of how does that make you feel? The second thing that I want you to avoid, the second question is, have you tried dot dot dot? In counseling, we really want to avoid offering any solutions or advice to our clients. So when we ask the client, have you tried dot dot dot, we are kind of in a roundabout way giving them a solution or advice. It also could lead to the client feeling a certain way, like what if they haven't tried that thing that I'm asking them about? it might lead to them feeling guilty or shameful for maybe not have trying that or maybe not have thinking about that themselves. So it's not that we don't want to guide the client and help them, come to a solution that works best for them, but we don't want to ask that "Have you tried?" question. So thanks for joining me today to talk a little bit about the counseling skill of questioning. I'll see you next time on Therapist Things with Dr. King.